I'm really excited today because I have a really amazing guest joining us. We have Denver Health's pediatric doctor, Joshua Williams, that's going to join the conversation today. And I was actually able to connect with Josh a few months back at the African American Health Fair, and it took place at the Doubletree Hotel in Park Hill. It was actually a really dope fair. They had a ton of resources for African Americans. And they had a lot of fun for kids. My daughter, she got her face painted and got a balloon made. It was really cool. And they were even offering testing and vaccinations on site, which I thought was really cool. But my sister and Josh, they actually both worked together at Denver Health. And my sister had a booth set up for Denver Health at the fair, so she was able to connect us. And Josh was so kind and extended an invite for me to participate in storytelling around the influenza vaccination to help encourage more Black and Brown families to get their children vaccinated with the flu shot. So I did participate in that. And the storytelling, it was such a great experience. So I'm really grateful that I had the opportunity to take part in that. So thank you for extending the invite. But I'll let Josh go ahead and officially introduce himself.
Oh, well, thanks so much for having me, Elia. And thank you for being brave and courageous to talk to a stranger at a health fair and decide to participate in something as cool as a storytelling project. It was a really powerful experience. So for all your listeners out there, I'm a general pediatrician. I've been practicing for almost 10 years now total, if you include my residency training. I see children from birth up until 21 years and college or next steps, vocational school, work, whatever it might be. And a lot of the work that I do on the side outside of clinic is about vaccines. It's research related to the safety of vaccines, what leads people to get vaccines for their children or not get vaccines for their children, and how we can work together to better understand the science of the safety and the effectiveness of vaccines and message that well to all the communities that we serve so that people can have trust and confidence in the vaccines we recommend.
Yes, awesome. Josh is a really kind person. I really enjoyed our time connecting with each other throughout this storytelling project, and I'm super looking forward to all of our videos being posted. So if you are a Denver Health patient and you have kids under the age of 5 or any pediatric kids in your house, you might get an email or a text with our video on it. So stay on the lookout. But today's conversation, I think, is very timely because flu season will be approaching in the next couple of months. So I felt like this was a very timely conversation to be had. I think a lot of Black and Brown households don't have the proper education on the flu vaccine, which contributes to them not really vaccinating themselves or choosing to have their children vaccinated. So I think lack of knowledge coupled with the history of distrust in the medical field and vaccines as a whole, I think that really contributes to higher mortality rates from the flu, especially in children and elderly. So today, Josh is going to educate us and just give us the 411 on the flu vaccine. So my first question is kind of outside of the flu vaccine, but why did you choose to become a pediatrician?
Oh, that's such a great question. I get asked that all the time by medical students and other people just exploring health professions. And I decided to become a pediatrician because it's what I was excited to wake up for in the morning in medical school. So in medical school, you train in a lot of different things. And I knew generally I wanted to be in healthcare. I grew up and was interested in science. I was interested in relationships. I was interested in education and being present with people. And I got into medical school and then I started trying different fields, surgery and medicine and pediatrics and radiology. And the one constant for me was I was excited to get up on my pediatrics rotation and go to work. And I think part of that was getting to play with my patients, right? A lot of the care that I give or the doctoring I do in clinic is just observation, right? I ask questions. Tell me about your birthday party. What did you eat? What was on your cake? And for a 4-year-old who can tell me about what was on a cake and what they had for their party, if they have the language skills to do that, then I know that they're doing perfectly fine from a communication standpoint. So it was a playful way for me to approach work. And then I also just thought it was such an important way to invest in the next generation, and to see people working really hard in the system that I went through, the University of Chicago, to try and really help build up the community by raising the next generation well. And so it was a fun opportunity in medical school to get up, feel that excitement, and now I get to do the same every day.
Oh, that's awesome. Working with kids, I'm sure, is very fulfilling too and takes a lot of patience. But I guess your job is a lot different than being a teacher. You see different kids daily, and you just are able to have like a different dynamic in that relationship with them. So that's awesome. Oh, that's really cool. So my
Yeah.
next question is, why do you recommend that children get the flu shot?
Yeah, it's a good question. Well, I think before, I talked to my families about getting the flu shot, I talked to my families about influenza and what is influenza. And I think we need to better understand what influenza is before we can talk about why I recommend the flu shot. And so, for people who, know a little bit more about influenza, they might know that it's a virus, and so it's not a bacteria; it's a virus, like many of the other viruses that go around in winter, coughs and colds, and the things that our kids usually get. But unlike most of the other viruses that circulate in winter that we often call the flu, influenza is a specific kind of virus that is known for causing respiratory symptoms, so lung symptoms, as well as whole body symptoms. And so when people think about getting a true bout of influenza infection, there's usually high fever, body aches, you feel super tired and awful, and you're struggling to breathe. And when it comes to influenza in America, influenza in Colorado, influenza in Denver, more broadly, we see thousands and thousands and thousands of infections every year. And sadly, when it comes to children, between 1 and 200 children die every year from influenza infections. And so it's not just a common cold. There's a common misconception out there that the flu is just a common cold. And if there's one take home point that I like to try and reinforce with families, is that that's not the case, right? It's more than just a common cold. It can be a mild infection in some children, right? Some kids are just going to have a fever and the sniffles and a little cough for a few days and it'll go away. But every year for 1 to 200 kids, that's not the case. And for some years, the season is worse and more children suffer and more children die. And for the purposes of this podcast, we know that Black, Latino, Indigenous children are 2 to 3 times more likely to suffer from influenza and even to die from influenza every year. So just thinking about what we're trying to do, right? We talked about building community. We're talking about preparing the next generation in our communities, right? We can't do that without our kids. And so I recommend the influenza vaccine. I get it for myself. I get it for my kids every year because it's the best way we have to try and prevent that unnecessary suffering and ultimately death of children.
Totally. So, like throughout your career so far as a pediatrician, have you seen a lot of deaths from children from like not getting vaccinated from the influenza?
Good question. No, I haven't seen many. I have seen one child who died from influenza. It was a 1-year-old girl. It was at Denver Health. And basically, her heart stopped beating because she got such bad lung disease, such a bad lung infection that she just couldn't get enough oxygen to her body. And her heart stopped beating. We did CPR on her, and she unfortunately died. That is a very severe case, right? So when you think about the millions of children in America, 1 to 200, that's not many overall. But getting back to the idea of this kind of suffering and death, it is preventable. And the influenza vaccine that we give, it's not 100% effective. That's something else that I talk to my families about. It's not a guarantee that if you get the influenza vaccine, you're not going to get influenza, but it's the best protection we have. And we know that kids who get the influenza vaccine each season are significantly less likely to be in the hospital or in the emergency room, and they're much less likely to suffer and even die from the influenza.
Yeah, that's really sad. A 1 year old. I mean, I remember you sharing that story when you were making your own story, but that is really sad, and especially for these little bodies, like it's so hard for them to fight off like infections, sicknesses, and illnesses. So, I personally think getting the flu shot is a great preventative measure to take, for your little ones.
Yeah. Well, I think the other thing I like to talk to my families about too is it's not just we're getting this influenza vaccine because we want to avoid the worst. There are also just a lot of annoying parts of getting the flu, even if you don't get a severe infection. A lot of parents have to take off time for work when their kids have high fevers. Kids can't go to school. They can't keep up with their grades, right? They get sick. They get deconditioned if they're in sports. Let's say they're in basketball, they're very active, right? They get a bad bout of influenza and they might be resting for 2 weeks. And when they finally do go back to practice, they're super tired. They can't keep up with the team in the way that they used to. And so there are a lot of other considerations from lost work and lost opportunity that I think we need to remember in the equation as well. It's not just those very severe circumstances, it's the more common ones of losing time at work and losing time at school and the impacts that that has on our families.
Yeah, there are consequences for that as well. So my next question is, when you're getting the flu shot, what are you essentially putting into your body? I've heard, I'm not sure if this is a myth or not, but I've heard that when you get your flu shot, you're essentially injecting the flu inside of your body. Is that true?
It's a great question. And when people talk to me about, I got the influenza vaccine and then I got the flu, that's often the concern that I hear about why I don't want to do it. So it's not true that you're injecting a live virus into your body. So there's no influenza vaccine that is injected into the body that's a live virus. Okay. There is a nasal version of the influenza vaccine. So it's a nasal spray that some children are eligible to get. And that one is a weakened version of the influenza virus. And so if you get a nasal spray version, sometimes you can get a little bit of congestion or runny nose after you get it. And again, that's a sign that your body is fighting off that weakened version of the influenza virus. But the flu shot that we give, the flu vaccine that we give in the arm or in the leg for children every year, that is actually an influenza virus that's been grown in a chicken egg over time, and then it's been heated up and killed. And it can't come back to life. It's not like a zombie virus where once you put it in the body, it can come back to life and cause influenza. All that happens is you take the active ingredient, a piece of the influenza virus that can lead the immune system to help form a response if the real influenza virus comes around. So I like to think about it like preparing an army, training an army to be able to fight off the real thing, right? So it's not a real virus that's injected, it's something that the body can use to learn how to fight off a real infection if that real infection does come around.
That makes sense. So why does it have to change every year? Why does the flu vaccine change every year?
Yeah, awesome question. So when we go into summertime in the northern hemisphere, the southern hemisphere goes into wintertime. And influenza is a sneaky virus. So it leaves the northern hemisphere, right? We all know that flu season starts maybe in September and it ends in March around here. And the opposite is true in the southern hemisphere. So influenza, with all the global travel that happens and just the very connected world in which we live, it travels around the world back and forth, north to south every year. And as it does so and spreads from person to person, the virus can change just a tiny little bit. The genes in the virus can change just a tiny little bit. And they can change enough to make it so that the vaccine that we got last year is no longer going to be effective against the strain of the virus that's going around this year. And so each year, historically, in the last few years, there have been two influenza A viruses and two influenza B viruses that we've used to protect against influenza, the four most common strains that we see worldwide. And we have to take a guess, right? We have to manufacture these vaccines every year. So we have to basically guess at what's circulating and what's going to be the next most common versions in the upcoming influenza year. And sometimes we guess really well, and sometimes something surprises us and the vaccine isn't as effective as we hoped it would be. But most years we do a pretty good job. The effectiveness of the vaccine is at about 40 to 60%, somewhere in that range, which means that if you get 100 people together who are all vaccinated against influenza, over the course of an influenza season, you'll see 40 to 60 less cases of influenza in that group of individuals than you otherwise would have, or a 40 to 60% reduction in cases is what I should say in that group of people than you otherwise would have if they weren't vaccinated.
Oh, wow. That's pretty impactful. Another thing that comes to mind is even people in my family I've heard say, my mom, for example, she'll be like, "Oh, I got the flu vaccine and I still got sick." Like,
Mm-hmm.
I'm like, okay, the flu is different from the common cold. So just because you get vaccinated, that doesn't mean you're not prone to getting the common cold or just, getting sick here and there. Can you kind of clarify that a bit more?
Yeah, absolutely. I mean, there are so many viruses that go around in the winter. And so you will get an influenza vaccine, which will protect against influenza, and you could still get a bunch of other sicknesses all winter long. I tell most of my parents of young children that it's normal to have somewhere between 6 and 10 illnesses in a year for a given child. And you can talk from your experience, Elia, with your daughter about what that's like to have illness after illness,
Mm-hmm.
right? And they're like, oh my gosh, are we ever going to be better?
Yes.
And a lot of times those illnesses cluster in the winter, and so it's not a one vaccine fits all and your child's going to be perfectly healthy throughout the winter. It's a specific vaccine for a specific severe illness. And I also like to point out to parents too that it doesn't even mean they won't get influenza. That's a common misconception as well. So you can still get influenza even after getting the influenza vaccine. In the same way that people learned with the COVID vaccine that you can still get COVID after getting the COVID vaccine. But the difference is the illness that your child gets is going to be much less severe than it otherwise would have been, right?
Mm-hmm.
And the idea is that for a child who's vaccinated who gets influenza, if they do get a fever and a cough and then they're better in 2 or 3 days, it's quite possible they could have had 7 days of high fever and a really bad cough, and they might have needed to go into the hospital. And so the fact that they just had a mild illness after getting the influenza vaccine hopefully means that the vaccine is working to help keep that illness as mild as possible.
Yes, for sure. Okay, so my next question is, what are the side effects of the flu shot? I think we briefly touched on this, but yeah, what are some of the common and not so common side effects?
Yeah, great question. So, the common side effects that we see with the influenza vaccine are things like pain. A lot of children cry when the vaccine goes in, and that's very normal. You see redness and swelling at the injection site also. And I tell parents that if your child, does well with a bath, for example, go home, take off the Band-Aid, put them in the bathtub, let them soak around and play. You can also give a dose of ibuprofen if it seems like they're having some pain or swelling. Occasionally, children will get a fever following the influenza vaccine. And usually the difference between the influenza infection and the influenza vaccine fevers are that the fever from the vaccine follows that first day after the vaccine, and then it goes away right away. And that's different from an influenza infection where fevers will linger for several days usually. And so those are the most common side effects that we see: pain, redness, swelling, and maybe a very low risk of fever as well. When it comes to more serious things, there are more serious reactions that have been shown in medical research studies, like allergic reactions to the influenza vaccine or one of its products. And speaking from my own experience as a parent, as I share it in my story in our storytelling workshop, my daughter actually had one of those allergic reactions. And the risk of getting those is basically 1 in 1 million. For every 1 million doses of vaccine that are given, one child might have an allergic reaction to the influenza vaccine. And now that's very, very rare. And in the case of my daughter, she went to an allergist. She was able to get cleared to try and do the influenza again in an upcoming season. And my wife and I talked about that at length, right? That kind of decision making is hard. Do we want to risk her having another allergic reaction? Or do we want to risk her having a severe disease that we know can kill 1 to 200 children every year? And the allergic reaction, we have medicines to treat that. And so we ultimately decided to go ahead and get her vaccinated the following year, and we continue to get her vaccinated now each year. And fortunately, she hasn't had any more reactions. But that's probably the one rare side effect that I'll never see again. I've seen one case, and now
Yeah.
it really is a 1 in a million sort of scenario. And so for all your listeners, I've seen one, so probably I won't see another one in my whole career.
Hmm. Very uncommon. Yeah, I think, well, I know for sure. Like when me and my daughter got ours, we usually get vaccinated together, which is amazing. She really looks forward to it. We get the matching band-aids, and it's just cool for us to be able to experience it together. I think it makes it less like scary for her, I guess. But she definitely had a fever afterwards. I gave her some Tylenol, was sore, but the next day she was running around like nothing ever happened. So I think those
Yeah.
side effects are very short lived, and the reward is much higher than the risk. So
Yeah, yeah. I remember my son this past year. We had signed up to go to just like a small little concert the night of his influenza vaccine. He got his influenza vaccine, and of course, that night of the concert, he was kind of out of it for a little while and sleeping on my shoulder while we were listening to the music. And then the next day, he woke up and he did fine, right? And so sometimes, I tell my families, if you got some big event or something on the night, well, just have that ibuprofen at hand or have that Tylenol at hand. It might help, but otherwise, it's short lived. And the comparison that I often make for kids, because kids want to have a role in these discussions as well,
mhm.
is and often the concern there is around pain and the pain of vaccination, which is something that makes a lot of sense. I just talk about this as a one-time poke, and it's a one-time pain. I've seen a lot of patients in my career who have to be in the hospital on oxygen tubing, who are getting blood draws every day, who are getting IVs placed, right? And this is a one time poke, very short lived, with the goal of preventing that kind of scenario for the child. And so I think inviting them into that decision making process with you, especially for older kids, can be helpful too. And I think it's so sweet that you do it with your daughter every year. That's so
Yeah,
special.
something to look forward to, right? I think that's a great segue into my next question, though, which you kind of already answered. But it's how do you make kids and families feel more comfortable getting the flu shot?
Yeah. Well, I think this is something that we haven't done very well just generally in medicine historically, right? I think a lot of times, historically speaking, you go to the doctor and the doctor tells you what to do, and then parents hold kids down, or parents, just say, be quiet, just sit there, do whatever the doctor says. I think we've really realized that that's not the best way to do things, especially with our older children and even younger kids, 3, 4, 5 years old, right? There are ways that we can try and decrease the pain and the discomfort of the vaccination process with them. So I work with wonderful behavioral health colleagues who have all sorts of techniques that they like to use, distracting kids with videos and movies that they want to do, singing songs together, blowing bubbles, right? We have numbing sprays that we can spray on skin so you don't feel the poke, or something where it's kind of a vibrating sensation that vibrates on the skin really fast and kind of confuses where the pain signals are coming from. And so you don't really focus on the needle that goes in, you're focusing on the vibration on your skin. There are comfort holds that parents can do. So instead of having a medical assistant holding a child down, the vaccine can be given with the child in the parent's lap, getting a hug from the parent, right? And then I think modeling what it looks like to get a vaccine yourself, or having an older sibling model that for younger kids, can be really helpful too, right? And saying, oh, yeah, it wasn't such a big deal for you. It wasn't such a big deal for the older kid. And it gives them a little bit more comfort. And of course, there are some children who have a true fear of needles, and that's something that we can work through with trained counselors for children over a period of time. But again, for most children during the office visit, there are lots of strategies that we can use to minimize discomfort and make that process a lot easier.
Awesome. Yeah, those sound like some really great strategies, making sure the kids are comfortable. I think that's super important. So my last question is, I know flu season is approaching. When do you think is the best time to actually get your flu shot? And is it necessary to get one like in the summertime or?
Good question. So in the summertime, no, there's no reason to get an influenza vaccine as long as the seasons stay as they traditionally are, which is between, mid-September and mid-March is usually the bookends of the season. And then we usually see a peak of influenza activity sometime between then, right around the holidays or maybe a little bit after. And so, we often start offering the vaccine around mid to late September. And, most of the employees where I work need to be vaccinated by sometime in October. And that's usually when I would recommend families setting a deadline to say, okay, as we come toward the end of September and the beginning of October, I should be thinking about making an appointment, right? October 1, I definitely want to have a vaccine before Halloween, vaccine before Halloween, because your body needs a little bit of time to mount an immune response, right? You have to form that protection. You have to form those antibodies, those fighter cells that are going to be able to actually fight off true influenza virus if your child gets exposed to it. And that doesn't happen overnight. So you don't get the vaccine and then immediately you have 100% protection. You need a few days to let the body's response get going. And so we know that, the earlier you get started, the better, just in general. And for young children, they'll need 2 doses in an influenza season, and they'll need to be separated by at least a month's time. And so for young children under the age of 8 who haven't received 2 doses in a season before, that's where you need to do a little bit more careful planning to try and make sure that you get in with that first dose and then you get your second dose a month later. Now, once you've had 2 vaccines in one season, then in future seasons, your child can just get 1. It's just kind of like getting a booster shot at that point in time. But just like the COVID vaccine, where there were 2 vaccines the first time around, where people were getting the first one and then the booster, it's a similar idea with very young children who haven't had it before. So think about calling your primary care doctor's office or going to a pharmacy near you sometime, again, late September, early October. And then certainly you want to have that vaccine in by Halloween. And again, for young children, hopefully even a second dose by then, because we know that the protection is even better with 2 doses on board for our youngest babies.
Awesome. Thanks for sharing those facts with us. This was great. Thank you so much for joining the conversation. I think this was super informative, as I expected. I'm just grateful that you took the time to participate. I hope a lot of our viewers and caregivers as well are feeling encouraged to get their little ones vaccinated this fall. Do what's best for your little ones and take care of them and take care of yourself as well. But to all of our followers, be sure to follow me on Instagram at Mommyana Podcast. You can also find me on Facebook, Spotify, Apple Podcasts, Google Podcasts, TikTok. I'm everywhere. And you can actually access all of these platforms through Urban Spectrum's Art19 platform, and that link is listed on my Mommyana Podcast Instagram page. I'm always looking for guests to join in on the podcast. So if you're interested in coming in, go ahead and slide in my DMs, or you can send me an email at mommyana.podcast@gmail.com. And a special shout out to my brother Derek, who does the editing on all of my episodes and also came up with the beat in the beginning. Shout out to you, bro. And check him out on IG as well at DWeatherlyBeats. But thanks for joining again, Josh. And we'll see all you Mommyanas later.
Thank you. I appreciate you having me.
D Weatherly gon' kill it.